Good evening, everyone. My name is Vipul Jain. I'm the founder and CEO of Advancells. Welcome to the 5th edition of our series, Ask Advancells. Our thought process here is to give you an in-depth analysis of a particular disease, of a particular aspect of Advancells, so that you get to know us better, you get to know what we do better, and you get a chance to ask as many questions as you want, and we try to answer them as much as we can. So today in this series, I'm gonna talk about one of the diseases that we get a lot of patients of, and it's one of our most requested procedures, and it's the procedure for MND, motor neuron disease, which is also known as ALS. MND is a pretty aggressive neurological disorder. It affects a huge amount of population across the world. It's not limited to any race, creed, color, caste. It can hit anyone at any time. In fact, nowadays we have started to see much younger patients, patients in their 40s, patients in their 50s, late 30s, who have started to show symptoms of the initial disease. And MND is one of the most devastating diseases that I know of in neurological disorders. So what is MND? MND is essentially a disease of the motor neurons. When the motor neurons in the body start to give up, they start to, stop behaving in the way they are supposed to. The brain is not able to send proper signals to the limbs, to the muscles, and slowly and gradually a patient starts to lose control over the muscles. Patient starts to lose the ability to use the muscles and gets into a very, very complicated condition. MND generally can start either from the top half of the body, wherein the hands get affected first, or it can start from the bottom half of the body, wherein the legs start getting affected first. Usually the patients that we have seen, the lower part of the body gets affected first, and then slowly and gradually it starts moving up. Typically speaking, once the diagnosis is made, the patients lose their ability to walk. Then slowly and gradually it starts affecting their hand. Slowly and gradually it starts affecting speech, ability to swallow, ability to eat, and then ultimately it starts affecting their ability to breathe, and that's when the mortality actually takes place. It's a very aggressive disorder. In typical patients, MND can, from start to end, the disease cycle can be maybe a year, 2 years, but in a lot of cases, it might take much longer as well. Unfortunately, conventional medicine does not really have any cure for MND. Conventional medicine also rarely is able to contain MND, or slow down the progression of MND. Every patient progresses in a different way, in a different manner, and at a different speed. So what can stem cells do for MND? Stem cells, what we have seen in our experience, once we administer the stem cells via lumbar puncture into the body, they are able to go into the brain and home into the neurons that are not behaving properly, and they can either repair, replace, or rejuvenate those particular neurons. And if that happens, then they start to work properly, and the patient can gain control or some control over their bodies. But more than that, what we have generally seen is the stem cells are able to reduce the progression of the disease to a large extent, which means that patients who are progressing in a very rapid state start getting more time, start getting their quality of life increases, their quantity of life increases, the lifespan increases, and they are able to maintain some level of quality in their lives till the time they are there. It not only helps the patient themselves, it also helps the caregivers, the patient's attendants, the family members in a big way, because ultimately when the patient does lose their ability to move and do their tasks themselves, it comes to the family members who have to take care of the patients. And the longer the patient are able to take care of themselves, the easier it gets for the family members. Stem cells, again, as you all know, it's an experimental therapy, but it has been showing some very good results, very promising results when it comes to MND, especially if whenever the patients are getting it done in an earlier stage of the disease. Which means that at least there is no breathing issues, there are no eating issues, they have some mobility left in their limbs. That is the time when really stem cells should be tried and can be tried, because that's when they get the ample amount of time to show their results. If the patient is in a very advanced stage, even stem cells are not able to help that much. But in our experience, almost 60% of patients benefit from stem cells. Of course, as we have been saying all along, there is never any negative effects due to stem cells. The disease does not progress any faster because of stem cells. So if there is a change, then it's for the better. But please make sure that if you are considering this treatment, you are considering it from a reputed facility with a reputed doctor. Please make sure what kind of cells you are getting. Please make sure the quality, quantity, viability, everything of the cells you have checked. You have made sure that they come from a GMP certified lab. And once you are able to find that combination, it's best to try it and pray for the best. So that's pretty much all the information that I have for you right now. If you have any questions, please feel free to ask us. We are there on social media. We are there. You can email us, you can call us anytime you want. If you like this video, please share it, tweet it. All the social media channels are open. Until I see you again next time, wish you a very happy new year, and I'll see you soon. Thank you very much.